Once again, you are welcome to Angel Health Academy. Subject: Community Health Nursing. Topic for the day is home visiting. Home visiting. Home visiting is the backbone of community health services. So it is the backbone of the community health services. Home visiting requires technical skills, knowledge of preventive and therapeutic measures, teaching ability, judgment ability, and understanding human relations. Definition of home visiting. Home visit is defined as the process of providing the nursing care to patients at their doorsteps. It requires technical skills, resourcefulness, judgment, and relationships. Home visiting is defined as the process of providing the nursing care to patients at their doorsteps. It requires technical skills, resourcefulness, judgment, and relationships. Home visit is a purposeful and deliberate psychosocial activity undertaken by the health team members for meeting the diagnostic and therapeutic needs of the family. So it is a purposeful and deliberate psychosocial activity undertaken by the health team members for meeting the diagnostic and therapeutic needs of the family. Objectives: to obtain information for family assessment, to get acquainted with the family, to begin a relationship of continuing assistance in the family health and health related needs. The objectives of home visiting are to obtain information for family assessment, to get acquainted with the family, to begin a relationship of continuing assistance in the family health and health related needs. The purposes. There are 9 different purposes of home visiting. The first purpose is to carry out simple nursing procedures. Second purpose is to prevent diseases. Third purpose is promote family health. Fourth purpose is planned family visiting program. Home visiting is a part of the planned family visiting program. Then fifth purpose is to investigate the sources of health problems. Sixth purpose is to assess the health status of the family members. That includes nutritional status, immunization status, and environmental status. Seventh purpose is to render health education, incidental and planned health education based on the identified problems. The eighth purpose is for follow-up services and continuing care to the family. The ninth purpose is supervise and guide the health workers and the family members. So the first purpose is to carry out simple nursing procedures. Second purpose is to prevent the diseases among the family members. Third purpose is to promote the health of the family members, the whole family members. Then fourth purpose is to conduct as a part of the family planned visiting program. So home visiting should be a part of the family planned visiting program, especially during the antenatal period and during the postnatal period. We have to conduct the planned family visiting program to that particular family. The fifth purpose is to investigate the source of infectious diseases in the community or in the family. Sixth purpose is to assess the nutritional status, immunization status, and environmental hazards of the family. To assess the nutritional status, immunization status, and environmental hazards of the family. Then seventh one is to give health education, to provide the health education based on the health problems of the family. That may be planned health education or incidental health education. Then eighth purpose is for follow-up services, for follow-up and care for the continuing treatment and surveillance. If there is a TB cases, taking DOTS treatments, there should be care for continuing treatment. Then if there is a leprosy cases, we have to make a follow-up services or care for continuing treatment. So the next ninth purpose is to supervise and guide the health workers. So community health nurse can supervise and guide the health workers during the home visiting and supervise and guide the family members when they do the procedures to improve the self-care activities. So these are the 9 purposes of home visiting. Next is principles of home visiting. There are 11 principles of home visiting. First one is home visiting should be need based, according to the need of the family. Second principle is home visiting should be the part of the planned family visit program. So it is the planned visit program. And third principle is home visiting should have a clear-cut purpose and objectives. Fourth principle is collection of the fact, that is collection of background information from the family in particular and community in general. So collection of background information, family in particular and community in general during home visiting. Then identify the health problems of the family members. Sixth principle is use safe technical skills and scientific nursing procedures during home visiting. Seventh principle is the approach of home visiting is kind and courteous and respect to the family members. Eighth principle is involve the whole family members during home visiting to plan and implement the family health care services. The ninth principle is provide health education based on the identified needs of the family members and the problems of the family members. The 10th principle is evaluation of the total health services. And 11th principle is record the activities rendered during home visiting. So the first principle is it is need based, according to the need of the family. Home visiting should be according to the needs of the family. Second principle is home visiting is a part of the planned visiting program. If there is an antenatal mother in the family or a postnatal mother, we have to make a planned visiting program to the particular family. Then third principle is home visiting should have a clear-cut purpose and objectives. Then fourth one is collection of the fact. During home visiting, we have to collect the background information, family in particular and community in general. So that is a collection of fact from the family and from the community. The fifth principle is identify the health problems of the whole family members. Then sixth principle is use safe technical skills and scientific nursing procedures during home visiting with the back technique. Then approach of home visiting is it should be kind, courteous, sympathetic and respectful approach. So during home visiting, a community health nurse has to be very kind, courteous, sympathetic and respectful to the family members. The eighth principle is family involvement. Involve the whole family during identification of the problem, planning and implementation of the healthcare activities. Then health education. Health education must be scientific, it should be clear, it should be sound and only in needed topic or important topic has to be dealt during health education. The 10th principle is evaluate the work during the home visiting. So evaluation must be concentrated on quality of the services, not the quantity of the services. So quality is more important than the quantity. The last principle is records. Records all the activities rendered during the home visiting in family folder and fill the individual health records and other records. So these are the 11 principles of home visiting. Next is steps of home visit, or aspects of home visit, or components of home visit, phases of home visit or process of home visit. So steps of home visit. There are mainly 5 steps in home visit. First one is initial phase, second one is pre-visit activities, third during the visit activities, fourth termination phase and last phase is post-visit activities. So there are 5 steps in home visit. A. Initial phase, B. Pre-visit activities, C. During visit activities, D. Termination phase and E. Post-visit activities. Let us explain one by one in detail. The first step is initial phase. Initial phase clarify the sources or reason for home visit, identifying the reason for home visiting and make the purpose and objectives for home visits. During initial phase, we have to make the clear-cut purpose and objectives for the home visit and prepare the schedule of the home visit. So initial phase includes reasons, purpose and schedule, RPS. The second phase is pre-visit activities, or second step is pre-visit activities. There are mainly 2 pre-visit activities. One is making the survey and preparation of the area map. Then second activity is identify the families in need of home visiting. So making the survey and preparation of area map and identifying the families in need of home visiting. So making the survey and preparation of area map, it includes the topography, location of villages, population, roads, electricity, water source, landmark of the community, etc. The second is identify the families or individuals in need of home visiting. It includes antenatal mothers, postnatal mothers, infants, toddlers, under 5 children, chronically sick or unable to attend the clinic, and physiologically challenged people in the community. So these are the vulnerable group in the community who in need of home visiting. The third step is during home visit activities. So activities during home visit. It includes self-introduction, observation, RCH or MCH services, illness or health problems, plan of action and implementations. There are 6 different activities during home visit. First one is self-introduction. Second one is observation. Third one is RCH or MCH services. Fourth one is illness or health problems identifications. Fifth one is plan of action. And sixth one is implementations. So let us explain one by one. First is self-introduction by the community health nurse. It includes the first day self-introduction by the community health nurse. On the first day of visit, the community health nurse has to introduce herself, name, designation, the PHC she belongs to, the purpose of the visit. Then there should be informal talk with the family members. Informal talk gives an opportunity to ask the questions and raise the discussion between the or among the family members. Then establish friendly relationship, a good rapport with the family members, and use simple sentence comprehension according to the level of understanding of the family members, and use simple sentence during communication according to the comprehensions of the family members. The second point is observation inside and outside the home. It includes environmental features, the condition of the house, the type of the house, cleanliness, hazards, source of water and electricity, methods of refusal of disposal, availability of sanitary latrine, availability of storage of food and water, sheds for poultry and cattle, stray dogs, pets, rodents, flies, etc. So these are the things has to be observed during the home visiting, both inside and outside the home by the community health nurse. The third step is RCH or MCH services. It includes to assess marital status of individuals and the family, identification of the eligible couples and pregnant women. If there is a pregnant woman in the family, find out whether the antenatal mother has been done registration, whether she has taken TT vaccines, and about her antenatal care, and whether she has done any antenatal clinic visit, etc. If there is under 5 children in the family, identify the health status of the under 5 children, immunization status, and assess the degree of malnutrition. Then regarding vital statistics, find out any recent birth or death or marriage in the family, and find whether they are registered in a correct time. Then any illness in the family. Identify any illness in the family like fever, rigor, skin diseases and other diseases like communicable and non-communicable diseases in the family. Then plan of action. Planning with the individual and the family. Involve the whole family members in planning the healthcare activities for the family. Then it should be according to the available resources at home and in the community bag. Then list out the action plans with the presence of the family. Then implementation. With the help of the community nursing bag, treat all the minor illness. Advise hospitalization if necessary. Undertake immunization if necessary for the under 5 children. Give health education on personal and environmental hygiene according to the significance. The fourth step is termination phase. Termination usually done when community health nurse client goals are or objectives are achieved, changes of the residence of family members, and transfer or reference of the client in the family. The last step is post-visit activities. It includes recording and reporting, follow-up and evaluation of total activities. So recording and reporting all the activities rendered during home visiting in the family folder. If further significance identified in the family, it has to be reported to the health team or to the medical officer. The second step is follow-up. The most important part of the home visit is follow-up services. To find out how far the instruction given were followed by the family members. To find out how far the instruction were given following by the family members. To give credit for what they have done at present. So encourage them, motivate them what they have been done at present. Discuss the problem with the health team members. If there is any problem that has to be discussed with the health team members. Analyze the activities and the resources availability and prepare a plan for the next visit. These all the things are included in the follow-up activities. The third activity is evaluation. Try to evaluate what has been achieved against the goals. Whether all the goals have been achieved or not. Then evaluate how far the visit has been useful to the family members. Then evaluate what have been the difficulties occurred during the home visiting. Then evaluate what more the needs have to be done in additional. Then review each family records periodically. So steps of home visiting includes initial phase, pre-visit phase, during visit activities, termination phase and post-visit. Initial phase includes reasoning, identifying the reason for home visiting, preparing the clear-cut purpose and objectives, and schedule the home visit. Second is pre-visit phase. It includes conduct the survey and prepare the area map and identify the family in needs of home visiting. Then during the visit activities include self-introduction, observation, RCH services, planning and implementation. Termination phase includes If the goal is achieved, the home visiting can be terminated. The change of residence of the family members or transfer or referrals of the family member, the home visiting can be terminated. The post-visit activities includes recording and reporting in the family folder and individual records and report to the significant problems to the health team members or to the medical officer. Continue the follow-up services and evaluate all the activities has been carried or rendered during home visiting. In short, the activities of home visiting includes facts finding, data finding, planning action with the individual or family, action and health education, follow-up services and evaluation of all the services. So the activities of home visiting includes fact findings, data findings, planning action with the individual or family, action and health education, follow-up and evaluation services. The next is essential equipment required for home visit. Essential equipment required for home visit includes community nursing bag, family folders, health education materials including flashcards, aneroid BP apparatus, weighing machines, baby weighing machines, any kit of medicines or special package of tools, an infantometer, then paper, pencil and pen for recording. Next is advantages of home visiting. The advantages of home visiting includes home visiting permits to see the family and home situation in detail. It permits to see the family and home situation. Second advantage is family members are more relaxed during the home visiting. We are rendering the services at their doorsteps, so they are more relaxed. Third advantage is it permits realistic teaching in actual situations. So we can make a incidental teaching in the actual situation during home visiting. And it provides an opportunity to contact with the other family members who are actually healthy. Then family gains confidence and free to ask questions because they are very relaxed and comfort in their own environment. Then it also provides an opportunity to assess the health problems of the total family members. It gives an opportunity to assess the total health problems of the family members. Disadvantages of home visiting. Home visiting is actually it is time consuming. It is not possible to render all the extensive care to the family members, and sometimes there will be a disputes and a disinterest from the family members and lack of equipment and resources. The last session is role and functions of a community health nurse in home visit. There are 9 specific role and functions for the community health nurse in home visiting. First one is to assess and record the information regarding the family. That is fact finding and data findings. Then treatment and care for the family members. Then demonstration of various procedures to the family members. Health education. Then supervision and guidance of the family members and the health workers. Then self-care encouragement to the family members. Then making referrals if necessary, counseling the family members and the documentation of all the activities rendered during the home visiting. Let us explain in detail. First one is assessing and recording the history of the family and problems identified in the family. Then treatment and care, that is medication as per the standing orders could be given to the family members based on their problems and other family nursing care services. Then demonstration of the various nursing procedures to the family members. Health education, that is incidental and planned health education based on the problems. Then supervision and guidance of the nursing procedure done by the family members and supervision and guidance of the health workers during home visit. Encouraging the self-care among the family members, making referrals or planning to carry the client to the hospital if necessary, and counseling the family or providing psychological support to the family. Then documentations. The documentation includes recording and reporting the activities. Record all the activities done in family folder and fill the individual health cards in the family folder. And complete the home visiting register. So today we have been discussed about the home visiting. The definition, objectives, purposes, principles, steps or phases of home visiting, essential equipment required for home visiting, advantages, disadvantages of home visiting, and role and functions of the community health nurse during home visiting. Hope this video really benefits in your studies. If you feel it is worth, please like, share and subscribe my channel. And stay tuned with Angel Health Academy till we meet with another important educational video. Thank you.